Have you got a hospital appointment coming up? And do you know whether or not you're still going to be on that waiting list to get that hospital appointment? Because the NHS is planning to remove 300,000 people from hospital waiting lists as part of a clean-up to scrap pointless appointments. Well, let's talk about this with Dr. Tony O'Sullivan. He's co-chair of Keep Our NHS Public and joins us now. Good morning to you, Tony.
Good morning, Julia.
Thank you for joining us. So who are these people who've got appointments and they're on a waiting list who don't actually need them?
That's a very good question. I'm not sure if the NHS will know that without a huge amount of work. They're supposed to be getting funding in order to make sure that they do this correctly. But
why do they need funding to do this correctly? I'm trying to work out who might these people be, because they're saying patients with common conditions like bad backs or cataracts will be contacted and directed for treatment at community services like GPs, physios, instead of waiting for a hospital checkup. But presumably they've been given the hospital checkup because they thought they needed it.
Yeah. Well, I would be with you in questioning the sensible nature of this without a lot more thought. I mean, what are the substantial reasons for 6.3 million people waiting for 7.4 million appointments? And it's not just because less than 5% of that total are unnecessary referrals. Yeah. And of course, it's a judgment call. And of course, you know, your mother's a GP. If a GP makes a referral to the hospital, if a GP makes a referral to the hospital, presumably they have good reason to do that.
They expect to do. I mean, there are some sort of follow-up appointments. I know people who have had operations and you get a follow-up appointment. They go, so how's it going? Is everything fine? They go, yeah. They go, OK, thanks very much. Well, that's a waste of everyone's time. It would be much better if that could be a follow-up phone call or a follow-up email. I mean, there might be some patients you're a bit worried about, so you're making sure, you know, we don't want to see that person actually in the hospital. You know, I'm very happy for all of my appointments with any medical, unless necessary, to be on the phone or by email. Let's just do it quickly and efficiently. But there are different patients who have different needs and different problems. But it seems to me my worry about this is there is going to be a massive incentive for hospitals to say, oh, let's try and get some more people off our waiting list because it will make our waiting list good. We look good. We already know we've got a problem in, say, A&E, where once someone is waiting way longer, you know, for a hospital bed than they should do, and they've already messed up their waiting list records, then frankly they go to the bottom of the list, whereas all the people who are sort of just within the 4 hours of being seen, they will get seen 3 hours and 55 minutes, and they kind of massage those figures that way. Wasn't there going to be an incentive on the hospitals to shove more people off those lists who probably did need an appointment?
I think there is. There's a kind of carrot and stick policy which can be very counterproductive. And of course, if GPs get the numbers that they need, and if there are community physios and community nurses, then that better care in the community will be celebrated by everybody, and more efficiency. Who would argue against more efficiency? I myself have had an operation, and I never saw the doctor again. I never saw a doctor again. It was all either telephone consultation or email, and that was absolutely fine for me. You know, I'm IT literate. I got email. Yeah. I've got an internet that works most of the time, I hope. And I've got the technology to do that. But in one survey, the National Literacy Association said that 6.6 million people have very poor literacy levels. Yeah. And I know from my own work in the past in disability, if you include poverty, literacy, mental health problems, sensory impairment, physical disability, learning difficulty, perhaps 30% of the population are disadvantaged if you rely on self-referral or apps and so on. Yeah,
so that is a real issue. They just can't navigate it, and they just don't. Well, also again, we have one of the biggest issues with hospital appointments is people don't make them. They might miss them. People tell them off for that. Often, they've been sent a letter ages ago. They don't live a very organised life, or they've got to work. A lot of the issue often is people they're doing day rate work. If they don't turn up for work on that day, they've been assigned an appointment, they can't turn up. Can I ask you about this another story? It's in the news, and this is according to the papers that the NHS is going to get its own Royal Mail postage class, so that letters about appointments are not arriving late. I've certainly had an appointment that was given to me for a date before which the letter had actually arrived. But it's a new barcode system, so it will automatically identify, separate and process NHS letters, giving them a priority. I would argue part of the problem is that the NHS uses too many letters rather than, the amount of times I've given my email detail on my phone and say, can you please use my email, the amount of times I'll still then get a follow-up letter. It costs money, it's very slow, it's very inefficient, it often has a number to contact which no one ever answers, rather than just doing things by email electronically, which would work for the vast majority of people in this country, if not all, but the vast majority.
Well, I think that the good administration of the health service has a long way to go. And there, I would say you need good management, you need good secretarial and admin support, and those kind of systems can be put in place where those people that can be contacted by email are contacted in that way, or reminded by text message. But the considerable numbers of people that are vulnerable to that method will have efficient communications by post. But the other important thing I wanted to mention, if you've got time, Julia, was the example of cataract surgery as an easy way of diverting patients from the hospital to the community. And I would have real worries about that.
Yeah,
because
it's a serious operation.
Well, it is. And the experience of the last 5 years has shown that diversion to a pathway that is from the local high street optician, of course, most of whom are really, really good, but their ability to refer directly to the private conveyor belt cataract surgery operatives mean that the amount of cataract surgery has gone up from 400,000 a year to 600,000 a year in the last 5 years. And in that same time, vision waits have not gone down from the NHS waiting list. They're still about 9% of the total. And the Royal College of Ophthalmologists are really worried that the explosion of supposedly simple cataract surgery by 50% has meant that the funding for that has been diverted to that pathway from NHS.
So that's an issue. That's something to look into. Thank you for that. I appreciate that. Dr. Tony O'Sullivan, co-chair of Keep Our NHS Public.